my name is Melody and I'm a student pharmacist. Today I'll be demonstrating how to check your blood glucose, which can be important for people who are diabetic. Now there's type 1 and type 2 diabetes, and I suggest that people who are either one should be checking their blood glucose. So today, the supplies we will need are a glucometer, testing strips that go with your glucometer. Now testing strips, there are specific testing strips for every device, so make sure that yours is the same brand. I also have a lancet, and also lancets come in many shapes and forms. Sometimes devices come with a lancet device, so you can just pick yourself with that. I also have an alcohol prep pad and a band-aid if I need to, and also a sharps container to put the lancet after I'm done pricking myself. I will first get a testing strip. You want to make sure that they're not expired and that you store it in a good place. You don't want it to be in a too hot place where it can get it can decompose. Like, these are really important since they are testing, and they also are very expensive. So you're going to want to put it in your testing device. It'll probably beep and it'll tell you that it's ready for blood. Now you will take an alcohol prep pad. I actually suggest that you wash your hands with warm water just to increase the blood flow to your hands. Since you want your hands to be warm, you can go ahead and clean the site where you are going to prick. I just want to talk about this right now, but other methods of making your hands warm include sitting on them, maybe shaking them, just so the blood flow increases and you can get a good sample. All right, get my lancet ready. This lancet I'm using has different penetration. I'll go ahead and be using the middle one. I'm going to go ahead and push and pull out the pin. Go ahead and place the lancet on my finger and push. All right, the blood came out already. Going to put it on the test strip. It beeped at me. It will tell me my results in 5 seconds. While this is happening, I can go ahead and put a cotton ball on my finger while it's reading. All right, and my blood glucose is 71. All right. Now, make sure you dispose of your lancet in the sharps container, and you can go ahead and keep a logbook with the number that you just got. Now, logbooks are important because you can go ahead and look at the pattern of your blood glucose, and you can also show your doctor, and he can kind of assess how you're doing with your insulin medications, with your insulin, your maybe your metformin that you could possibly be taking. All right, and I just want to go over what the numbers mean. There's 2 kinds of blood glucose measurements that you could have. You can have your fasting glucose and your postprandial glucose. Your fasting glucose is usually taken over maybe a long period of time, such as 8 hours, like when you wake up, and that number should be under 126 milligrams per deciliter. The other number that you could take is the postprandial glucose, like I said, which is done like 2 hours after you have eaten. That number should be under 200. And just remember that if you have numbers, if you have like one reading that's above these standard numbers, don't worry. It's usually a combination or a long amount of time of these numbers that you get that determine if you have diabetes. If you're concerned at all, make sure to talk to your doctor or your pharmacist who can help you with these devices. All right, thank you.